And we are back with cardiologist Dr. Christopher Schumann talking heart health as we're wrapping up Heart Month. So what kind of signs should we be on the lookout for that would indicate that it's time to check in with your provider?
Yeah, so symptoms of a blockage in a heart artery, classically present with chest pain when you exert yourself, or when you're under emotional stress, feeling discomfort in the chest. But for some patients, it presents more as shortness of breath. But in either case, chest pain or shortness of breath when you're exerting yourself, definitely a reason to be evaluated. Um, Symptoms of a weak heart muscle or heart failure, those could be also shortness of breath when you exert yourself, or shortness of breath when you're trying to lie down to sleep at night. It could also be just feeling really fatigued all the time or lightheaded, or having swelling in your legs. Those are all reasons to be evaluated.
Okay.
And then a final symptom that we often get referrals for is heart palpitations or feeling like your heart's fluttering or racing. That could be a sign of an abnormal heart rhythm, and important to be evaluated.
Gotcha. Okay. Some people believe that if you look healthy on the outside, right? Maybe you do run a lot or do you exercise, then you must have a healthy heart. Let's talk about some silent signs or risk factors that people should know about.
Yeah, as that plaque forms in your heart arteries, it typically doesn't cause symptoms till it's causing about a 70% blockage of the artery. So there could be a lot of plaque in the heart arteries, and you could be totally asymptomatic. And so that's why it's helpful, those tests like that calcium score we talked about, where we actually are able to see how much plaque is in the heart artery to try to get patients on the medications to prevent that plaque from growing and decrease their risk of having a heart attack.
Okay. So warning signs. I think that people are always kind of, and you alluded to them just a little bit, but let's talk about them a little bit more in depth because I think that's what people at home are thinking to themselves, well, I feel this way or I feel that way. What warning signs should they be telling others about that they need to like call 911 for or seek medical attention for?
Yeah, so definitely any chest pain that comes on and lasts longer than a few minutes is a reason to call 911. That could be a heart attack. But it's important to recognize too that, in some patients, particularly in women and elderly patients, heart attacks can present differently. Often it's more shortness of breath. But certainly any chest pain that lasts more than a few minutes, severe shortness of breath, those are reasons to call 911. Another symptom that also warrants kind of immediate evaluation would be any passing out or losing consciousness, particularly if it happens suddenly without warning. That could be a sign of a dangerous heart rhythm and important to be evaluated.
Gotcha. And I think of when you say that, like with women, it presents something different. I think so often they'll just pass it off and just say, oh, I don't need to go to the doctor. Or if I go and it turns out to be nothing, then I'm going to feel, like I shouldn't have gone. But you would say, you just go.
Absolutely. And we do see that sometimes people say, well, I had this episode of shortness of breath a week ago, and I thought, I'll just power through it. And it was a missed heart attack. So, for each patient, you kind of know your body. And if something doesn't feel right, it's important to be evaluated. But certainly, any chest pain or shortness of breath that's not going away, definitely better to be evaluated for sure.
All right, so for people who have survived a heart event, what steps should they take or keep on top of to help prevent yet another occurrence?
Yeah, so number one, I would say would be sure to follow up with your cardiologist, and just make sure you make those follow-up appointments. Number two, I would say take your medications. Particularly, if you get a stent in your heart, you'll be started on a couple medicines to help keep that stent open. So it's critically important to take your medications as prescribed. And then the third thing I would say is kind of working on those risk factors to prevent another heart event. Taking your cholesterol medicine, diabetes medicine, getting that blood pressure down, working on those lifestyle changes that we talked about with diet and exercise. A great program after someone's had a heart attack is cardiac rehab, which is a supervised exercise program that's offered to patients to help them improve their exercise capacity after they've had a heart attack.
Okay, we have about just under a minute. What final piece of advice or action step would you like to leave with our viewers about having a healthy heart?
Yeah, I know we've talked about a lot of different lifestyle changes to make, and I know it can seem overwhelming at times to patients if you're thinking, well, I've got to quit smoking, start exercising, work on my diet, get my blood pressure down. And I always tell patients, just start small. It may not be that you're going to start exercising 30 minutes a day, but just start going for a walk for 5 minutes today, and do that this week, and maybe in a couple weeks you increase that to 10 minutes, and you build up to that goal of 30 minutes of walking a day. So I would just encourage patients, start small, focus on one thing, stick with it, and you can achieve some really great results that'll have a lasting impact on your heart health.
All right, small changes to big changes. Thanks so much, Doctor. We appreciate your time. If you missed any of this, this is going to be in the To Your Wellbeing section of our website.